Pride, size, and tradition are just a few characteristics that people use to describe Texas and Driscoll Children's Hospital. Pride. South Texans are proud of our founder, Clara Driscoll, and the institution that bears her name. Born in 1881, she was way ahead of her time. During her lifetime, Clara was known as an accomplished author, playwright, and politician. In addition, she served as a confidant to President Franklin Delano Roosevelt and the Tiffany Glass Company. When Clara heard that the Alamo was going to be destroyed to build a hotel, she wrote a personal check to save it and then gave it back to the state of Texas. But perhaps her greatest act of service and kindness was leaving her family's fortune to a fund that later created Driscoll Children's Hospital. Size. Opening in 1953 with just 25 beds, Driscoll Children's Hospital has grown to include over 191 beds, over 30 pediatric and medical surgical subspecialists, and a service area the size of South Carolina. Most first-time Driscoll visitors question how such a large tertiary hospital can survive in a city the size of Corpus Christi. The answer is demographics. Texas is the second largest state by size, population, and growth rates. The Texas population is predicted to double by 2050, and in the future, Driscoll will benefit from that growth. Presently, Driscoll serves a population of over 2 million, whose average age and birth rate are way above the national averages. These demographics are so powerful, they've unsuccessfully attracted other large children's hospitals to consider moving to South Texas. Tradition. Like our founder, Driscoll Children's Hospital brought many firsts to South Texas and to Corpus Christi. Driscoll Children's Hospital opened in 1953, becoming the first and only freestanding children's hospital in South Texas. The first pediatric open heart case was performed here in 1962 and the first organ transplant in 2007. And in 2020, Driscoll Children's Hospital and UTMB collaborated to bring the first pediatric surgical fellowship to South Texas. Pride, size, and tradition describe Texas and Driscoll Children's Hospital. But don't take my word for it. Listen to some of my colleagues who have come from around the nation and literally around the globe to care for children at this amazing place we now call home, Driscoll Children's Hospital.
Hi, I'm Dr. Mohammed Emran. I'm one of the pediatric surgeons here at Driscoll Children's Hospital, and I've been operating down here in South Texas for over 15 years. My areas of greatest interest are obesity and wound healing, and I've worked together with our other surgical specialists and nurses to create a successful wound care team. I completed my surgical residency at the University of Illinois Metropolitan Group Hospitals in Chicago and my fellowship in pediatric surgery at the University of Montreal St. Justine Hospital. I grew up in Texas and went to medical school at the University of Texas Southwestern in Dallas and came back after my training. Texas is home after all. South Texas specifically had a lot to offer me. The small city life, the great beaches, the access to many close-by attractions and places to travel make this a really nice place to live and work. No traffic, low cost of living, wonderful work environment at a standalone children's hospital with all the medical specialties represented makes it ideal for a surgeon or trainee. South Texas has a surprisingly high rate of index cases that have kept us engaged and busy over the last decades. If you're interested to learn both the bread and butter operations that you'll routinely see when you complete your training, as well as the unique challenges of the large number of index cases, this is a great place to do just that. We're very excited to have you join us to learn from the wide variety of patients and surgical procedures we see here at Driscoll Children's Hospital at our fellowship.
My name is Siboney Zapata, and I'm a pediatric otolaryngologist. I was born and raised in South Texas, about an hour south of Corpus Christi. I completed my residency in otolaryngology in Memphis, Tennessee, followed by a fellowship in pediatric otolaryngology at San Diego Children's Hospital. Specializing in pediatrics allowed me to develop a special skill set to help a vulnerable group of our population. I started my career in academics as an assistant professor at Emory University in Atlanta, Georgia for a few years. My Texas roots drew me back to Austin, where I practiced at Dell Children's Hospital for almost a decade. Since joining the Driscoll team in early 2019, I have discovered a medical community dedicated to the health and wellness of all the children in South Texas. It has been an honor to have the trust and faith of our South Texas families to care for their loved ones. I hope you'll give serious consideration to the UTMB Driscoll Pediatric Surgery Fellowship Program. I look forward to working with you.
My name is Shannon Kaler. I'm one of the pediatric surgeons here at Driscoll. I was born and raised in Wisconsin. I attended college, graduate school, and medical school there. I moved to Hawaii for general surgery residency and then back to Wisconsin for my pediatric surgery fellowship. My husband, 3 children, and I moved to Corpus Christi in August of 2019. We have really enjoyed our relocation. The weather is wonderful, the practice keeps me busy, and the team is amazing. As most pediatric surgeons, I love this field for the wide scope of practice. There is certainly a plethora of interesting cases here. One special interest I have, resulting from my PhD in endocrinology and reproductive physiology, is disorders of sexual differentiation. In pursuit of that interest, I've been able to join a multidisciplinary group here at Driscoll to take care of these patients. Another of my main interests is oncology. As I continue my career, I plan to become part of the COG and participate in oncologic research. I also greatly enjoy minimally invasive surgery, and particularly thoracic surgery. I hope to innovate in this field. That's a little bit about me, and I have really enjoyed my time at Driscoll. I think you would too. I look forward to working with you.
My name is Ashley Hanna, and I'm the pediatric neurosurgeon at Driscoll Children's Hospital.
I'm Leanna Steele, and I'm the pediatric neurosurgery physician assistant here at Driscoll.
I grew up near Detroit, Michigan. I completed 2 undergraduate degrees in Ohio and then moved back to Detroit for medical school. My neurosurgery residency was at the University of Chicago, and I spent my PGY 6th year at the University of Miami doing an infolded neurotrauma and neurocritical care fellowship. My peds neurosurgery fellowship was at Emory Children's Hospital of Atlanta. My husband and I moved to Corpus Christi, Texas in August of 2019. Since moving, we had our first child and are very excited to build our home here. We love the inviting atmosphere of the hospital and the relaxed city on the water. My main interests are in neurotrauma and neuro-oncology. I have been able to care for a wide variety of patients and disease processes, including tumors and traumas, as well as congenital brain and spine anomalies, spine tumors, and epilepsy. The general surgeons and subspecialists have been very supportive as I've been building my practice. We look forward to having you join us here at Driscoll and hope we can teach you a lot.
Hi there, Harun Patel here. I am a pediatric surgeon with special training in urology as well. I have been at Driscoll Children's for more than 17 years. I left Boston and academia because I wanted a busy clinical practice that allowed me to practice the full gamut of pediatric surgery that I felt I was trained for. I went back to Boston after several years. It's a great place, wonderful people. However, it only served to reinforce that I preferred operating a whole lot, so I came back to Corpus Christi. And my passion lays in taking care of a broad spectrum of surgical conditions rather than super specialized. This is why I think this program would be a great place to train. The staff are easygoing, the camaraderie is unparalleled, people treat you well and they are respectful. The resources provided to you to perform any and all surgical procedures well are tremendous. The cost of living is low comparatively, and there are plenty of opportunities to enjoy everything that the Coastal Bend has to offer. And yes, even if you are a busy pediatric surgical fellow, I am sure you will find the time to enjoy everything that is around here. And who knows, you might get to separate another set of conjoined twins while you are here. Yes, we have the resources to take care of complex technical and resource-intensive cases such as these. We are now 5 years out from completing the first ever successful ischiopagus tetrapus conjoint twin separation that were part of a triplet pregnancy. Never happened before. This required the coordination of more than 50 healthcare personnel in the entire health system to come together to achieve a successful outcome. And I'm happy to report that the triplets are doing great. So come on down and check us out.
Hello, my name is Misty Moy, and I've been part of the Driscoll family for over 20 years when I first started my career as a registered nurse. And now I'm lucky to work as a nurse practitioner with a great group of talented and caring pediatric surgeons and pediatric urologists. They not only provide exceptional care to their patients, but truly love to teach others, such as residents, nurses, and soon-to-be fellows, to provide the best care to children through evidence-based medicine and from their own many years of experience. Another great thing about Driscoll is that we have many different specialties, such as oncology, hematology, endocrinology, nephrology, neurosurgery, ENT, and urology, to name a few. And the providers here at Driscoll work closely together as a team to provide a collaboration of care for the patients. I am so proud to have a freestanding children's hospital in my hometown of Corpus Christi, Texas, that serves all the children of South Texas. And I hope you will consider Driscoll Children's Hospital and UTMB as your pediatric surgery fellowship, and I look forward to working with you.
Hello, my name is Leon Smith Harrison. I was born in Panama and raised in San Jose, California. I attended UC San Francisco for med school and continued there for my urology residency. The Peds Urology Fellowship was done at the Children's Hospital in Philadelphia, and I've been practicing pediatric urology for 35 years, the last 11 years here at Driscoll Children's Hospital. I've been a longtime member of different societies, Pediatric Urology, the AUA, and Section on Urology, and the American College of Surgeons. From residency, I've been interested in pediatric surgery and urology. Loving children and the creative nature of the surgery captivates me. My particular interest is in hypospadias. So we love to teach, so come to the Driscoll Children's Hospital.
Choosing your pediatric surgery fellowship training program is an important step on a journey to becoming a pediatric surgeon. If your journey is anything similar to mine, you'll learn many things. First, pediatric surgery is a very small community, so you're going to keep running into the same people. Second, pediatric surgery provides opportunities that can literally take you around the world and introduce you to many important and influential people. Finally, and perhaps most importantly, pediatric surgery will allow you to provide a lifetime of caring and learning. My journey began at the University of Florida, where I received my undergraduate and medical degrees. I then went to LSU in New Orleans, where in 1987, I met my mentor, Bob Ahrensman, and fell in love with pediatric surgery. Dr. Ahrensman taught me how to do clinical research and write and present papers. These paper presentations took me to meetings in Colorado, Montreal, and Stockholm, Sweden, where I took a little extra time to celebrate my honeymoon with my lovely wife, Suzanne. Dr. Ahrensman also helped me develop a strategy that would improve my chances at matching in pediatric surgery. This plan included a 3-year research position in the immunobiology laboratory at the University of Minnesota with Dr. John Najarian and Arthur Matus. In that lab, I met and worked with surgeons that, unbeknownst to me, would show up later in my life. People like Dixon Kaufman, Joe Leventhal, and John Fryer. While completing my general surgery training at the University of Minnesota, Dr. Ahrensman moved from New Orleans to the University of Chicago and started a pediatric surgery fellowship program where I eventually matched and became their second fellow behind Dr. Tom Renard. Chicago was a mecca for transplantation, so it dovetailed nicely with my training at the University of Minnesota. So during my pediatric surgery fellowship, Dr. Ahrensman asked, and I agreed to accept a transplant fellowship at Northwestern under the tutelage of Dr. Stewart, Dr. Mike Abacassis, Dr. John Fryer, and Dr. Dixon Kaufman. After completing my pediatric surgery and transplant training, I joined the faculty at Children's Memorial Hospital and helped Dr. Superina start their first transplant program. After 10 years in Chicago, we moved to Corpus Christi in 2005 to assist Driscoll Children's Hospital in growing the Department of Surgery. Since then, we have added 3 pediatric surgeons, as well as pediatric urology, ENT, bariatric, and trauma services. We performed over 120 kidney transplants and partnered with UTMB to offer a pediatric surgery rotation for their general surgery residents. And now we're ready to offer you a fellowship position in pediatric surgery.